So the title of this presentation is Gamified Immersive Learning in Healthcare, and in particular looking at the patient compliance challenge. And I'd like to share a few slides with you. The overall message that I want to get over today is that we have this kind of circular situation in which technologies of all kind can help to enable gamification, because gamification in itself is not dependent on technology. And gamification can influence behaviours, which in turn drive technologies. And the reason why I asked the polling questions right at the beginning of this session was because you can look at this in two ways. You can either look at technology as being something that's been responsible for some of the lifestyle deterioration or lifestyle behaviours which have resulted in chronic medical conditions. And there are arguments that would say that technology has actually had a bad effect on us by reducing the amount of exercise that we take and other things. So you could argue that it's a vicious circle, or you could argue that it's a virtuous circle. And what I want to talk about today mostly is the kind of technologies and applications which actually enable a virtuous circle. So those technologies which enable gamification that can lead to positive healthcare behaviours, which in turn drive and fuel developments in technology that are good for society. So here's a look at some graphs. The first graph is showing the change in the lifestyle related causes of death in the period 2000 to 2015. And although you can see that it varies according to income group, and in the low income group, certainly in 2000, the majority of causes of death were communicable diseases, less so in the lower middle class, and certainly a lot less in the upper middle class and higher income. But over this 15-year period, there's been significant change in the cause of death from chronic diseases, away from communicable diseases to chronic diseases, many of which are related to lifestyle behaviours. So globally, inactive lifestyles are a global problem, and you can see by adult and by children, for adults and children, by different countries, the countries which seem to have the highest levels of inactivity. And you can see in Benin, that's got the lowest level of inactivity, and raising to Qatar, which has very high levels of inactivity, both for adults and some children. Now, the important thing for today's session is looking at the cost of non-compliance. In other words, the healthcare costs that are related to people not adhering to medication. And I make this distinction because we're talking about medication, people who don't comply to medication. So we're not talking about lifestyle generally. In other words, people who are not taking medication. We're only talking about people who are taking medication. And for those people who are not taking medication, in Europe alone, the estimated cost of non-compliance or non-adherence is around 1.25 billion euros per year. So you can see that non-compliance is very expensive on public health services. And here are a series of reasons for non-compliance. And again, I think we're primarily talking about medication. These are the results of some research which identified a number of reasons why people don't comply with the healthcare regime. So I'd like now to launch another poll, and I'm going to choose a different poll this time, and this time I'm going to ask you what you think are the most common or most important reasons for non-compliance. So I've launched the poll now. So I'm asking, what is the most important reason for non-compliance in your opinion? Is it denial of the medical problem? Is it the cost of treatment that's prohibitive for some people? Is it difficulty in compliance with the treatment routine? Is it because there are unpleasant side effects? Or is it because there's a lack of trust in the clinical advice? Or maybe it's just because people are apathetic about taking their medication. Or maybe they've had a previous bad experience which has put them off taking the medication. What do you think are the most common reasons for non-compliance of a medication? So I'll give a minute or two, a second or two for people to put in their answers. So now I'm going to share the polling results with you. And you can see mostly it's to do with the denial of the problem and the cost of treatment. So thank you very much for those replies. Some interesting results. And I'm now going to move on to the slide presentation. And I'm going to talk about now how games influence behavior. And then I'm going to move on to how gamification can influence healthcare behaviors. Well, for those of you who were involved in the last webinar last week on gamification, you may well have seen this slide before. But games have certain characteristics. They have a start point and they have an end point. And now we're talking about any kind of game, be it golf or cards, of any kind of game need to mention. And the end point is usually some kind of objective or goal or target, which has an outcome, a result. In worst cases, it's game over. But I like to think of games as having a destination. So that leads to the concept of games being the kind of journey which take you from a start point to a destination. And along that journey, all games have these common characteristics. They have a challenge, they have a level of risk or uncertainty, they have some kind of motivation, which is usually related to a goal or an objective. Games, most games are the same each time that you play them, but they're also different every time. If you had the same outcome every time you played a game, you would soon lose interest. But games like golf vary depending upon the course, the weather, playing conditions, and so on. Games also involve a level of choice, which has an influence on outcomes. And games also involve some kind of measurement and feedback of the results. So games can be addictive, and the best games are addictive, but they're not addictive to everybody. So not everybody likes golf, not everybody likes cards. They also can influence behaviors and develop certain skills and also habits. And finally, the best games are games that you can never completely master. So let's look at the same kind of situation, and I'm using myself as a bit of a guinea pig here when I'm talking about gamification of healthcare. So what is the starting point and what is the destination in healthcare? Well, the starting point is where you are, what your medical condition is at the moment. And going back to 2013, using myself as an example, this is what I looked like when I was in a play on stage in May 2013. And this was the time, and I'll go into the reasons shortly, when I decided to gamify my own health. So I started in May 2013. I wanted to gamify my health, and where I finished up in September 2013, only a period of 3 to 4 months later, was a much healthier person. And so I basically gamified my journey. And so I injected for myself all of these things into my own healthcare. I made it a challenge to myself to walk a certain distance every day. I was uncertain. There was a certain element of risk in gamifying my health. I didn't really know what the outcome would be, but I was prepared to take the risk. I was motivated because I had concerns about my own health and the risk of diabetes. At the time I started this journey, I was living on my own, so I could choose what I ate and when I exercised, and this influenced on my health and well-being. And finally, I had tools which allow me to measure my performance and get feedback from that. So in 2013, this is me demonstrating a concept of gamification, and the concept is not what you might think. It's nothing to do with celebrating eating honey as being a recipe for good health. It's more to do with the way in which adults gamify their children to encourage them to eat their food. So what I was doing there is playing a game where I was pretending to try to persuade a child to eat the food, and so I was pretending that my mouth was a tunnel and the spoon was a train, and the train goes into the tunnel was a metaphor for the child eating. And by making it fun, children will be encouraged to eat things they maybe didn't want to eat. The enabling technologies that I used in 2013 were the jawbone up. And so the measurement and feedback that I got to gamify my own health were a graph which showed me my heart rate. It showed me how much sleep I'd had the previous night out of 8 hours, 86% out of 8 hours, the number of steps that I'd taken, or percentage over 10,000 steps, and it showed me my performance. These are three different applications, 3 different devices that I use, and all of them showed different kinds of data, but all basically focusing on providing me with information about the results of my gamification and how I was performing compared to my targets. And I proved to myself that in a relatively short period, I could make substantial improvements in my physical and mental health. So on the left-hand side, what you see is the gentleman with a moustache. That was me actually 20 years ago in a stage performance. This was me prior to 2013, running a workshop in Kuala Lumpur. You can see I have quite a stomach on me. And you can see what happened in the period between May and September. And this change was maintained between 2013 and 2015. So you can see before and after results, standing with the same person in 2013 in Kuala Lumpur, and again in 2015 with the same person, and you can see the difference. So in 2013, the technologies that were available for me to measure and control my own feedback were 2 kinds really, were devices which took snapshot data. So I'd measure my weight, my body mass index at specific points in time. And at the same time, I would be wearing a wearable device which would effectively capture data in real time. So my recipe for compliance to improving my own healthcare and adopting this healthy life regime was really based on gamification and incorporating all of these elements into my own lifestyle and seeing what the impact of that was on myself. And so it was a case that I had some enabling technologies which I used to gamify my own health. These in turn influenced my own behaviour and encouraged me to continue to look at developments in technology and become enthusiastic about the area. So the lessons that I learned during this period between 2013 and 2015 was that walking 10,000 steps every day, setting myself that target, has definitely improved my physical and mental well-being. And I'm proud to say that over the last 7 years, between 2013 and now, I've walked 10,000 steps or 5 miles virtually every day. At least 99% of days I've walked 5 miles. I also discovered very quickly that it's actually diet is the most important thing. Diet is more effective at losing weight and maintaining your health than exercise is. Exercise has certainly improved my physical and mental well-being, but it hasn't been responsible for my weight loss. The diet's been responsible for my weight loss, and it's the same with this combination of exercise and particularly diet can help to prevent and even reverse diabetes, the latest research shows. I also discovered that it's not just a question of diet and eating less calories. It's also important to remember to have a balanced diet with the right levels of nutrition, and that protein is important in preventing muscle loss. And finally, the two things which are increasingly realized as being important are that you need to drink a significant amount of water every day and look after your sleep. And both of these are important in maintaining good health. And the other thing that I discovered now that I live with my partner is that it's much more difficult to be compliant to this kind of healthcare regime when you're in a relationship with somebody than it is when you're living alone. So now moving on to gamification and making the connection between gamification and compliance. I have the belief that every human activity can be viewed as a game. So the whole of life is actually a game. I rather like this picture of this young man looking out the window saying that reality is the worst game ever. So gamification, I think, is something that not just human beings are born with, but I think that they are embedded into the DNA of all living creatures. So when we are born, I believe instinctively we have an ability to gamify as a part of natural behavior. And if you look at any animal, those people who've got pets, dogs or cats, will quickly realize that dogs particularly are able to influence their owner's behavior by the way that they look and the way that they behave. And so it is with children. Children grow up learning about the world around them, and so they set challenges for their parents simply as a way of understanding and developing the skills that they need in later life to be able to grow and develop. So I believe that over a period of time, as we get older, these ability to gamify decline. As we get used to a lifestyle and we settle into the same kind of daily habits, we lose the ability to gamify. It's not quite so instinctive. We tend to think of games being as something in this context, what children play. So I want to, for those of you who have not seen it before, just introduce you to what I call the gamification lens, which is a way of looking at every human activity as if it's a game, and as if it's a game where people have different roles within the game. And so I started by applying the gamification lens to what people will accept as a game. I think the game of football as a sport. And so people have different levels of involvement in this game. At the bottom level, we have people who are not at all interested in football or any kind of sport. I call these hermits. That makes no difference to their life what happens to a football team, what happens with any of the sports results. The next level up is a spectator, and they don't really have a strong interest in the game, but they like to read newspaper simply to get in touch with what's happening in the world, but they are not interested in really getting involved and supporting. Above that, you have the fans, and this is where you start to get the sustainability elements of games. Fans are people who do care very much about the game or their life activity. So they have a certain level of passion and engagement, and that's reflected in the amount of time and energy and passion that they're willing to invest in the particular sport. Above that level, you've got players, and the players are the people who can influence their result. So they want to go beyond simply being a fan. They want to be the people on the field, playing the game and influencing the outcome. And above them, you have the strategist, the tactician, motivation, and coach. These are people who are able to apply gamification strategies to their players and their team to get the results that they want. Now, if you apply that to healthcare, how does that bear out? So who are the players in healthcare? Who are the hermits? Who are people who are not really interested in looking after their own personal health? They don't regard it as being something important. Who are the spectators who maybe read the paper and look at what's happening in the world with coronavirus, but they are not so interested that they take any positive action either way. Above that, you have the fans and the active supporters. Now, these are people who really think that it's important to respond to a healthcare challenge. So these are the people who will self-isolate. These are the people who will wear masks. They're not medical practitioners. They're usually the general public. And above that, we have the people who can influence the outcome of any particular healthcare challenge. So we have the doctors and the nurses and the hospital staff. And above that, we have what I call the games master. And these are people who have the ability to influence the outcomes of any healthcare challenge. These are the people who influence lifestyle behaviours, and they influence personal health management. So the objective with gamification, if you apply the gamification lens and compliance, you start off at the bottom level as being a hermit, and you can graduate to being a spectator, a fan, a player, and finally the games master. So what does this mean? Well, it means that when something like coronavirus strikes, or when there is some kind of medical problem, there are those people who are hermits. They bury their heads in the sand. They are apathetic about the problem, or they're ignorant about the problem. So what we try to do with gamification is to move them from being in a state of ignorance and apathy into a greater level of involvement and support. And by support, I mean moving on towards compliance and taking control and responsibility for health. So we go from, in the gamification lens concept, we go from non-compliance, which is something that the hermits will do, to not only compliance, but proactive compliance. People who are constantly looking proactively at ways in which they can influence and control their own behavior. Looking at the second concept in gamification, and that's the gamification cycle, which I argue is made up of a number of stages, which start importantly with all games and all lifestyle activities with a challenge, which we respond to. We measure the results of our response, and this provides us with feedback. And each person responds in an individual way. So in terms of healthcare, you have a medical challenge. You think about your response. What can I do to that medical challenge? What can I measure? Can I measure it to anything? and will I get feedback on how I'm doing? So these are a full list of healthcare elements that you can build into designing any kind of gamification experience. And I should stress that these elements are not dependent on technology. All of these elements apply in everyday life. So you will see people using gamification as a human skill, and all of these elements will come into play. Also, you will have influencers. And so influencers are the individual characteristics that affect the way people respond in making decisions and choices. I call it the A list because most of these begin with the letter A. I'll just show you a couple. And one of the healthcare influencers is authority. So who will you listen to? In the current coronavirus situation, we are being urged and advised by both political leaders and health leaders. Every day there is a news broadcast from number 10 Downing Street in the UK with the Prime Minister or one of the leading cabinet ministers, flanked by leaders in public health, and they are exhorting people to behave in a way which is compliant with public health needs. So it's wearing masks, it's self-distancing, it's self-isolation, etc. But also we are influenced by something called adjacency, which is the influence of peers. And so how you respond to a healthcare game challenge depends on often the influences of your peers. Who do you know? Do you know anybody who's got coronavirus or has had coronavirus or even died from coronavirus? This is more likely to influence than you if you don't know anybody who's had coronavirus, and if most of your friends or your peer groups are young and healthy and not generally affected by coronavirus. So when we come on to the general point about technology, gamification, and compliance, today we have a number of disruptive technologies which are shown on the left-hand side. Things like wearable devices, Internet of Things, devices talking to each other, cloud computing, artificial intelligence, big data analytics, smartphone technologies, virtual reality, and wireless communications. All of these are developing at a rapid pace, and all of these in different ways. And I'm going to show you some of the different ways by talking about a number of different case studies in which these technologies enable the gamification elements of creating challenges, introducing chance and uncertainty, improving levels of motivation to be compliant, generating experiences which are different every day. It's the same experience, but you receive different information, different prompts every day, which give you choices, but help to influence those choices towards healthier lifestyles and provide you with measurement and feedback. So all of these technologies or combinations of these technologies can be applied to these gamification elements, and each of these in turn with the gamification elements can address some of these barriers to compliance. So they can influence, for example, denial. If you make it clear to someone that they have a problem or that they can do something about their health, maybe they're less likely to deny that they've got a problem. The falling costs of technology also make compliance more acceptable, so cost is less of an issue. And again, with the artificial intelligence and some of the other technologies, they can also influence the level of difficulty in compliance and also reduce some of the side effects. And there are very good examples of the use of gamification and technology to reduce, for example, pain associated with dressing wounds, for burns, for example. Technology can also, through gamification, influence the level of trust that we have in a compliance regime. They can help to combat our apathy, and by providing us with good experiences, they can help to address that barrier also. So these are the ways in which technologies can address the compliance issue. And these are some of the developments that we've seen since 2013. I remember it was 2013 when I started on my healthcare gamification journey. And since that time, I've seen enormous developments in wearable devices. They've gone from being simply fitness trackers to being more clinical grade. And in fact, some wearable devices now are approved by the FDA, and they are regarded as medical grade devices. The smartphone apps, as smartphones have become more and more powerful, these smartphone apps associated with healthcare have become increasingly sophisticated and have a lot more artificial intelligence embedded into them, which helps to create gamification opportunities. The broadband has developed significantly from 3G to 4G, being commonly available, and now we are at the dawn of 5G, which again will also improve the ability of technology to enable gamification. We've also seen increasingly, and I'm going to talk about this briefly, the emergence of technology-enabled healthcare ecosystems. In other words, the ability of technology to create a network of win-win relationships, which are based on gamification, fueling win-win relationships. For myself, I've seen changes in my lifestyle as a result of my relationship, living with somebody. There's been lots of positive benefits to that, but also I'm going to talk frankly about some of the difficulties arising from moving from living on your own to living with someone else. And more recently, of course, we've seen the big game changer of pandemics, coronavirus, lockdowns and social distances. So all of these things have happened since 2013. And so what I'm now going to look at is just a series of case studies based on these different elements. So I'm going to start by looking at wearable devices and mobile apps. So I know that I'm going to kind of revisit what I'm doing today with wearable devices and mobile apps to compare that with what was available in 2013. I'm going to talk about briefly technology and enabled ecosystems. And then I'm going to give a case study on telehealth and remote patient care. And I'm very much hoping that I'm going to be able to invite Lucia Panese of Imaginary to join me to talk about her solution, Imaginary solution called Rehability, and how this combination of technology gamification is able to provide a better solution with greater compliance for people having rehabilitation therapies. I'm going to talk about some applications to do with artificial intelligence and big data analytics. And finally, I'm going to move on to virtual reality and immersive technologies and games. And if there is time before the end of this webinar, I'm also going to again give a demonstration of a coronavirus game, which with enabling technologies is a sort of game that can be developed by anybody with affordable technology and a little bit of enterprise and innovation. So what do I do now as far as wearable devices and mobile apps are concerned? Well, I've graduated from the Jawbone device, and I try and show this on the screen now. So I'm actually using a Fitbit, and I'm using the top of the range Fitbit, and what I'm showing you here are examples of the screenshots which help me to comply with a healthier lifestyle. So starting from the left, the screen that you see there really is a snapshot, which first of all gives me some challenge. It shows me my activity and it encourages me to look at a piece of research which can improve my healthcare. So when I talk about gamification, injecting something the same but different, there is a different piece of advice every day. So this snapshot shows me how long I've been exercising for, how many miles I've walked, how many calories I've burned, and what my sleep score is, how long I slept. I'm particularly interested in maintaining a healthy heart. I'm very conscious of the fact that I am still obese. I've gone back to being obese in these last 4 or 5 years that I've been involved in a relationship. So I do take care to monitor my heart rate and check my cardio fitness. And the Fitbit shows me my resting pulse rate each day, and it also shows me what my cardio fitness level is for a person of my age, and I'm happy to say that it's excellent. So on the opening page, I also see how many out of 9 hours I've completing more than 250 steps. And this is one way in which gamification, wearables and gamification come into play, because what Fitbit does is based on a recognition that it's not good to be sat for inactive for long periods of time. It encourages you to walk at least 250 steps every hour between 9 and 6. And so if I've been sat, as I will have been from during this webinar, for an hour, at 10 minutes to the hour, it will give me a vibration on my wrist and tell me how many steps I've got to do to make the 250 up. And so I actually have been responding to this. So I'm conscious when I get a vibration on my wrist at 10 to the hour, I do get up and walk around. It shows me my current heart rate. It shows me how many days out of the 5 working days of the week I've completed 10,000 steps. And because this was yesterday's data, I'd only done Monday, so it's showing me Monday. It showed me how much weight I've lost, so I set myself a target of getting back down to 90 kilos. And so I still have 5.7 kilos to lose. It shows me how much water I've drunk, and it shows me how many calories I've consumed. So again, this was yesterday. And you can see on the right-hand side of the screen my heart rate and how that has changed. And what this tells me, or what I've learned from this, is looking at that heart rate graph, my resting pulse rate, when my ideal resting pulse rate from a personal point of view would be around 49 and 50. And I can see that it's gone up to 53 the previous week, and this week it's gone up to 54. And when I try to understand why that is, I can point to Saturday night barbecue where I ate too much and drank a significant amount of alcohol, and that had an impact on my heart. So looking at my heart in particular, it breaks down my daily activity in terms of the amount of exercise I do. And this was based on Sunday, where I was working in the garden quite a bit. So I did 17 minutes of peak exercise, 1 hour, 9 minutes of cardio, and 8 hours, 20 minutes when I was burning fat. And so you see along the rest of the screen, you can see my calorie consumption, my calorie intake, and my calorie expenditure. And even though I have burnt more calories than I've consumed, my weight loss hasn't been as much as I would have expected, and I'll explain the reasons behind that in a moment. My sleep score has varied a lot, and again, On the night of the barbecue with the alcohol and drink with friends, my sleep deteriorated badly that evening down to a level of 57. But my water consumption the next day tried to compensate from that. So the lessons that I've learned now in 2020 are that my relationship has changed my lifestyle dynamics. And those lifestyle dynamics and compliance with the kind of regime that I'd like to achieve have resulted in a tendency, because we share the same house and we do things together, we tend to eat later than I would do if I was on my own, and we tend to watch TV a lot more than I would if I was on my own. And both of these are not good for my health. I've already mentioned the fact that alcohol increases the resting heart rate, but it's the diet and the eating routine which are areas that I have really got to address if I want to not only improve my physical and mental health, but also reduce my level of obesity and subsequent risk of diabetes. So looking at different case studies, I've just looked at the Wearable technology case study involving myself, and now looking at how technology can enable ecosystems which build personalized win-win relationships. So you see, they are very patient-centric, and they're very personalized. And where gamification and technology come into this routine is that we are now seeing technology-enabled relationships between the manufacturers and developers of wearable device and insurers and employers. So we are now seeing insurers saying, if you take out a health insurance with us and you take an Apple iWatch or a Fitbit, and you can prove that you are walking 10,000 steps or you are leading a healthier lifestyle, you will get a significantly better deal with your insurance. So that's a gamification strategy based on a technology enablement. And it's the same with employers. There are some employers now who are offering the same incentives to their staff because they realize good staff health is important to productivity and absenteeism. So again, they are forming relationships with manufacturers of wearable devices to make these devices available to their own staff. And so it goes on with different kinds of technology enabled relationships between family and doctors, for example, family having access to for the elderly parents, health data, technology enabled. We've even got health clubs now working to collect data about health and fitness, and encourage working with manufacturers of wearable devices to encourage people to adopt healthier lifestyles. So there are many different examples of technology-enabled ecosystems which encourage healthy compliance. Well, now I'm going on to telehealth and remote care, and I'm just going to look at the attendees. And I'm going to find Lucia Panesi, and I'm going to promote her to be a panelist and ask her to join me on the screen. So, Lucia, if you can hear me, can you switch on your camera and microphone? There you are.
Hi, David.
Hi, Lucia. Thank you very much. Nice of you to join me. Well, I've used Rehability as an excellent example of telehealth and remote care to illustrate how technology-enabled gamification is making a difference to rehabilitation. So perhaps you would like to tell us a little bit about the background to Rehability and the way in which you use gamification and technology to improve compliance with rehabilitation therapies.
Yes, thank you very much, David. So the current version that we have with Rehability is dedicated to neurology patients, so adult patients. So what you said before, even adult people or elderly people like to play still, but you have to find the right way to motivate them to do so. So we've been working on quite a number of years on international research, so that we could understand in a very detailed way, of course, the scientific background, which is, of course, to be preserved. So in other terms, understanding how traditional rehabilitation is working for this kind of patients, both in terms of motor exercises and cognitive stimuli. But then what we did was involving some samples of adult neurology patients, so people between, say, 60 to 90 to 95, into our game design work, because we really wanted to capture their motivation. So in other words, we wanted to come out with digital interactive games that were, on the one hand, putting in place the kind of exercises that therapists and neurologists and so on wanted them to perform, but in such a way that patients could make some sense out of it, and that they could find some entertaining side in their rehabilitation. So this was quite some very interesting work, which is documented in several scientific papers that we have. Well, I must say we succeeded because, for example, we saw some interesting videos taken by a German therapist who showed the patient doing the same exercise in a free space, so a sort of upper limb, so arm movement, without any kind of digital support. And the patient was very much concerned about the kind of movement he was doing. He was concentrating on his arm. He was, well, tired and lamenting pain and so on. But then again, a couple of days later, when the same patient was working with the game in front of him, so the attention was completely put on the screen and on his game challenge and objective, we could see, of course, the patient was filmed from behind for privacy reasons, but you could immediately see that the movement was much more free, much more natural, because the attention was not on the arm and on the movement, but on the screen and on what he was supposed to do there. And actually, from there on, therapists started to report that patients are much less tired and they don't complain so much of fatigue, and they see the point, they see the improvements that they're doing. And as you said before with your Fitbit and your story, they have their own target that they want to reach, so they have their best performance always under their in front of them, so that they can check it all the time, and they can see if they get better or if they're almost as good as they have been already, and so on. So all these things are motivating them a lot. The idea that we are putting in place now with this system is that the patients train with the games at home, under specialist monitoring, but the therapist is not connected all the time, of course, because you need scalable systems. So they put up highly personalized therapy plans, which means picking those games and configuring those games in a way that they are the right thing to do for the patient in this moment of the therapy. And then they check data, as you mentioned before, and patients can train in those times in the day when it's more comfortable for them, and when they feel more at ease, and they can always check their performance, so they get empowered at the same time.
Okay, thank you very much for that, Lucia. So I think that is an excellent example of how you can use technology to gamify a therapy. Lucia mentioned one particular thing which I'd identified, not I, but researchers identified. One of the barriers to compliance, particularly in rehabilitation therapy, is either the difficulty or the unpleasant side effects of doing the therapy. In other words, patients who experience pain whilst they're doing the therapy are less likely to be motivated to carry that out. But the gamification element of rehabilitation focuses the patient's attention on the screen. And by doing that, and many different kinds of research have shown this, it's a focus on a game-like activity does reduce the level of pain or increase the pain threshold of the patient. So patients are more likely to comply for that reason. So that's a very good example, and it's a very good example of how you can create a technology-enabled win-win ecosystem, which includes the patients, their family, the doctor, and so on. So moving now to the next example, which is the use of artificial intelligence and big data analytics. And I just picked up this newspaper article. I think it's from the Independent newspaper in the UK. And it's just an illustration, an example of how the food industry are looking towards artificial intelligence and genomics, in other words, DNA testing, for personalized diets. So by personalized diets, this means not just health conscious food, but also responding to research which indicates those types of food which are most effective for an individual person's DNA or genomics. Turning to virtual reality very quickly, I want to cite an example of a company in the USA called XR Health, and they have developed a lot of applications based on the use of virtual reality for a range of different medical conditions, including some physical ailments, but also things like dementia, things like stress management. And the thing that I'd like to draw your attention to is that they have created what they call a virtual reality telehealth kit. And you see that on the right-hand side of the screen. And the thing to note is what I was talking about, technology-enabled ecosystems, is that you can obtain this VR telehealth kit at no cost if you have it linked to health insurance. If you don't have any insurance, you can still buy it and control it yourself, but you have to pay $399 a month. So that's an example of gamification as an incentive or a motivation to form alliances with insurance to create this kind of win-win ecosystems that I mentioned. So now moving on to immersive technologies and games. I'm only 5 minutes away from the finish time, so I think I will only have very limited time to show you the game, but I just want to show you the point I'm trying to make about the developments in technology and how they can enable the creation of games which influence our compliance and behaviours. And I use as an example the coronavirus situation. So this part of the webinar was concerned with how to create a gamified coronavirus immersive learning experience with the following objectives. And all of these I think you would recognize as being objectives which almost, well, virtually every country in the world is adopting at the moment to try and reduce the impact of coronavirus. And of course, the most important thing is compliance with good health practices. So if you look at this in terms of the game psychology and mechanics, if you look back to November, December last year when coronavirus first came out, we had a starting point which was a virus which had all of these characteristics. And what we wanted to do, and what most governments and what most health services wanted to be, is in a different and a better place at the end, with the virus under control, the economy not completely trashed, with resulting in improved levels of freedom for people to meet and interact with each other, getting back to normal, but with an increased public awareness and changed behaviours. and in various ways, some of which were technology enabled, some of which weren't. Then different governments, different players, different stakeholders who adopted, used technology to address these challenges. And these challenges and the use of technology are basically informed by the constraints that we currently face with coronavirus, and that is that meeting face-to-face in many places and having physical contact is very difficult or not impossible. There is a need to improve citizen understanding and awareness, and so on. And these are the technologies that I used in creating the coronavirus game. So these are the enabling technologies: drone, a 360-degree camera, smartphone, a laptop, and some software. The point I try to make is that all of these technologies and tools are usable and affordable by most organizations or who have a vested interest in compliance and healthcare education. So this is what I needed to create the game. These are the design parameters that I used in creating the game environment. We are virtually at the finish time of the webinar, so I won't demonstrate it, but if any of you would like a personal demonstration of the coronavirus game, please contact me by email, either by the email address shown at the end of this presentation, or if you can respond to the recorded version of this webinar. So that's the loading screen. That's the starting screen, which shows the game objectives and rules. It's a game based on Asia, so most of the environments, immersive environments in this game are based on Asian locations, which include Malaysia, Singapore, Thailand, etc. I do compare two different types of games: the game that I developed using the tools that I showed you, and another game developed by Focus Games. Both games had exactly the same objectives. Both games used exactly the same healthcare data, and I asked people to try both games and look at how they're different and whether those differences matters. So going back to gamification, enabling technologies again, we'll go back to the start point. I asked the same question again. The technologies do enable gamification, and gamification influences behaviors, and those behaviors can influence technologies. And it's pretty much up to us whether we use technology in our own situation to create a virtuous circle in which all of these things lead to improved behaviors and improved healthcare, or whether we perhaps fall back to some of our older ways in which technology is actually less of an incentive to comply with good healthcare regime. So finally, this is a roadmap that actually I created some years ago, where I see technology going. It's already gone to some of those places already. So consumer devices, wearable ones, are already providing healthcare metrics. We are now seeing healthcare costs more linked to lifestyle behaviors, particularly in the cost of insurance. We are seeing revolution in the healthcare ecosystem by these enabled partnerships. We are seeing the use of wearable lifestyle devices for things like banking and identity applications. I think in future with coronavirus, we'll also see it as a mechanism for identifying whether or not a person has had coronavirus or is a coronavirus risk. In future, I think we'll see more and more embedded devices embedded in our bodies that not only give us gamification, but also control some of the physical characteristics of our body. So that is the end of the presentation. Here are my contact details. If you want more information, there is the website to visit. You can also find a link to the coronavirus game there. And if you want to email me, then there's an email address to go to there.